Hi everyone, it's Marie here from Fit Mama. I wanted to do a little video for you lovely pregnant ladies who are suffering with pelvic pain, pain in the hip sockets, lower backache, all that general achy, uncomfortable feeling that you get around the pelvis as your pregnancy progresses. And sometimes, it can be really hard to get to see a physio, especially if you are UK based and the waiting lists are quite long. So I'm going to show you a really simple method to help you to combat the problem and actually manage it. Self-care is so important and actually can prevent the need to go and seek help from your GP for a referral. So all you need is a couple of prickly balls like these two. They're fairly softish, but you can get slightly harder ones. I get all of mine from Amazon. There are other online traders available. Try to get two exactly matching balls of the same size, same colour, same softness or hardness. And then all you're going to do is find your way down to the floor. Now, I tend to keep pregnant women off their backs for exercise, but for rehabilitation, we need to get you on your back so that we can target the areas accordingly. So lift your bottom up and pop the balls underneath each meaty part of your glutes, so your bottom cheeks, and you want to just check that they're in the right place. So feel for your pelvic bones underneath your fingers. That might be a little bit difficult if your bump is quite big, but you'll probably remember roughly where that sensation is. And then check that the balls are directly underneath that spot. And that's going to target all the juicy muscles that we need to soften. So I'm going to move my hands out of the way, but you can have them just on the floor, or you can tuck them behind your head like I'm doing. That will open up your diaphragm and really help you to get some air in. So begin a very gentle roll from side to side. And what I want you to do is to just press a little firmer into each ball. You might find that they slip out depending on the type of clothes you're wearing. Lycra is not great for prickly balls. And see if you can create an infinity symbol, or a figure of 8 is probably the easiest way to think of it. Let your legs move comfortably to help you. So when we're targeting these muscles by giving them a little massage with these prickly balls, what will happen is it's like going for a deep tissue release, and all of this pressure from the balls forces the muscles to relax so that when you need them to work, they can really engage very well. So lift your bottom up slightly, roll the balls up about an inch, I'd say, and then bring yourself back down to the balls. And we should be targeting the medial gluteus area, which is in short terms, the fillets of steak to the top corners of your pelvis. And as your pelvis tilts in pregnancy, as your baby grows, these muscles can get very tight. So you might find that this area is just a little more tender. And again, you might need to reposition the balls. This is something you can do every single day. Anytime you're feeling lower back pain or hip pain, any of those kind of sensations that you might be feeling, even sacroiliac joint dysfunction benefits from this release. And then we're going to lift the bottom up, take the balls out, and very carefully bring your spine back down to the floor. You want to try and replace it one vertebra at a time, and then let your bottom come down at the very end. Really nice, well done. And that should feel absolutely like you've been spread out. Really nice feeling. So a couple of other things you can do. If you don't have pubic pain in pregnancy, you can probably benefit from this other add-on. So if we put the balls back for a second, and just make sure it's right in the middle of the meaty part of your bottom. Let your knee fall out to the side. And if that's not aggravating your pubic bone, you can roll from side to side and really target the piriformis muscle in this way. Or if that's hurting too much to roll, you can just let the leg fall and just allow it to relax so the inner thigh is stretching and the pressure is on the piriformis. This is really useful for people who have got toes that are turned out like ballerinas, and obviously applying pressure to these muscles will help you to straighten the feet and realign the pelvis. So bring that foot back in. Obviously, you would do both sides and roll if you want to. You don't have to roll, but you can. And then lift up. Squeeze your bottom really firmly to activate the muscles again. And then slowly, 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 one bone at a time, reset. And hopefully that should make you feel much, much better.